everybody, I'm Journo Jess. Today I'm here to talk with Nurse Tayler, who actually spoke with me back in August. And now I want to find out how she is continuing to cope with the pandemic. Since the last time I spoke with Nurse Tayler, I have continued to follow her on her social media accounts. Often she speaks about the importance of people wearing their face mask and what she is going through on a daily basis. Today I want to hear more about the struggles she has had to endure and how she is coping. Hi Taylor, how are you doing today?
Hi, I'm good. How are you?
Yeah, so far so good. I know things have been a little rough since the last time we spoke. Can you kind of tell me, what has changed since August, since we talked?
Yeah, unfortunately, things have gotten much worse. I hate to laugh about it, but yeah, the caseload has increased significantly. So we are way busier than we were back in August. Our caseload, I think for the last 5 days, we've beat our record of new cases consistently every day for the last 5 days. And I think last week, Navajo Nation had 900 new cases just that week.
Oh my goodness. I also saw that are you technically on a stay-at-home lockdown order right now?
The reservation is correct. Yeah. I'm staying right off of the reservation in what we call border town. And there's not really any COVID rules here, including like a mask mandate, anything. But the reservation did go back under very strict lockdown. So that's caused a lot of problems in itself. But yeah, that was in response to the insane surge in cases.
Okay. And in terms of like the cases, have you noticed like that the death toll has went down at all?
No. It hasn't gone down. Yeah, it has not gone down.
Have they had any type of treatments that new treatments they've been trying out, I guess?
Yeah, and we do know more about the virus. As a nation, we know more about the virus. I'm not really seeing that specifically here. In my personal opinion, in my personal experience, I haven't really seen that much of a difference. And, all the medical knowledge that they've come up with and all these discoveries of these great drugs, it doesn't really mean a lot if the drugs aren't accessible, and it really doesn't mean anything if there's no room in the hospital to treat the patients, which is, what we're running into a lot of lack of resources here. So it only goes so far.
Yeah. And you said before that there's like absolutely no beds available for people. Mm-hmm. Is that correct?
I don't know about at this very moment. I know within the last few weeks, there's been multiple days I've come to work. Like one day I came to work and there were 0 ICU beds in the state. Yesterday I worked. We were trying to transfer a patient out and we couldn't find anywhere to send them. Like it's just a multiple occurrence for me that we're trying to, call 2 or 3 hospitals to find room for a patient. And so, yeah, hospital beds is definitely a scarce resource these days, which is really scary. Even, it's like I tell people, if the ICU is full because of coronavirus patients and then you get in a car accident, it doesn't matter that you don't have coronavirus, the ICU is still full.
Wow. What do you do in cases like that?
You just things just kind of happen. But honestly, I mean, a nurse takes care of more patients than they're supposed to. ICUs go beyond their limits, hospitals go beyond their limits, and that's what's happening. I haven't personally seen this, but I have seen hospitals across the country put out statements that they are soon going to reach their limit and start turning patients away, which is really scary. I mean, this is America in 2020, and you think about the concept of a hospital turning patients away is just insane. But I do think we're headed towards that point. Just from my personal experience and my personal professional opinion, I think we're headed towards that point.
Oh my goodness. So do you think are people still not taking the pandemic seriously? Is that the problem?
I don't think that's the problem within the Navajo people. It's not an issue of them taking it seriously. A lot of the reasons that it's spreading so uncontrollably here are out of their control.
Mm.
I definitely think the general population is not taking it nearly as seriously as we should be. But, the Navajo, there's no work on the reservation. They have to work off of the reservation. So when the surrounding community isn't taking it seriously, it affects them. And then they go home to their multi-generational households that are home to 9-10 people, including their 92-year-old great grandma. And there's a lot of factors. I think nearly half of the population lives below the poverty line. So, when I tell someone, you were exposed to coronavirus, I need you to take off for 2 weeks. 2 weeks of missing a paycheck is pretty detrimental to someone living on low wages. So there's a lot of reasons and a lot of factors outside of their control that's contributing to the spread.
Yeah.
And we preach, hand washing. 1 out of 3 households out here don't have running water. So, the spread is inevitable.
Yeah, I remember you telling me the last time I spoke with you, you said, there's generally a lot of people in one household. They definitely don't have running water. So I know that is definitely a factor. So that's probably still obviously the case, really, why the cases are continuing to go up.
Mm-hmm. Yeah.
So I know the last time we spoke, in terms of like resources, like maybe PPE or any other things, like, has that gotten any better?
PPE is fine. I think PPE is that in terms of resources is fine. The biggest issue is resources available to the community. I personally tried to get food for a patient today and was just told, we're out, we don't have any, sorry. So that's an issue.
Wow.
There's just resources available to the patients is pretty scarce now.
What about, I know your main role is track and tracing. Do you have enough testing available?
We have enough testing. That's not the issue. Now we are running into the problem of we have so many cases coming in a day that it's impossible to keep up with contact tracing. Like at our height over the summer, we had like 20-ish cases coming in a day. On Friday, we had, I think, 67 new cases that day. And so we're constantly 40, 50 new cases a day, and it's just impossible to contact trace for that many people. So testing's not the issue, but manpower and contact tracing is a huge issue.
Wow. So do you have a team of people that you generally work with?
Yes, public health nursing is my quote unquote team. It has expanded greatly because it's kind of an all hands on deck effort now. We have people from nutrition, people from like pharmacy, the physical therapist, everyone's contact tracing now, but it's still not, it just doesn't seem to be enough. We kind of always make a joke of like, we're just the violin players on the Titanic because it's just going down and we're just, just keep playing. I
know, when you've traveled for your nursing stuff before, I can't remember what it's called right now. It's like left my mind. Where like, people like go overseas and, if they're having like natural disasters and they have people come in. What?
Yeah, like aid work and NGO nursing.
Yeah. I heard that people like that are starting to come to the U.S. because the cases are so high. Have they come to your area?
So when I got here in July, Doctors Without Borders, which is like the most prestigious medical NGO in the world, and they were here on the ground in July, which they've never deployed to within the United States before this. They were here on the ground. I came here with COVID Care Force, which is an NGO, and they still have a very big presence on the ground. I'm just employed with IHS. Project Hope is another NGO that I have deployed to hurricanes with before. They have a presence on the ground. So yeah, there is definitely a big aid presence on the ground, which I think is just mind-boggling to me that I'm in America seeing the problems that I'm seeing and dealing with and I'm working side by side at aid organizations. The last time that I worked side by side with Doctors Without Borders was in a refugee camp in Greece, and now I'm doing it in, rural Arizona. And last time I worked with Project Hope was in a hurricane disaster response, and now I'm doing it here. And I think it's just insane to me that this is really happening in America.
I know, currently America is undergoing a huge transition of a new presidency. So I was just kind of curious, seeing as how the previous president was handling it before, and now the incoming one has a different plan and an obvious different approach. Are you thinking things might change?
Yeah, I am definitely thinking things will change, especially considering, the previous administration didn't really have a response, and their handling of it was to not. And I think the fact that, the new administration has a COVID task force that is made of nothing, composed of scientists, doctors, immunologists, infectious disease doctors, and nothing else, I think that alone is reassuring. So I am very hopeful about this new administration. However, inauguration isn't for another month, and things are only getting significantly worse by the day. Mm-hmm. It's not just that things are getting worse; it's the rate that things are getting worse is, I think, really scary. And so I do have, I think, a fear of how bad things will be before the new administration is able to put things into effect. And I know there's a lot of hope surrounding the vaccine, which I also am super hopeful, super excited about it. I will definitely be getting it as soon as it's available. But there's no guarantee that the general population will, which is what it's going to take for us to get back to normal. So I'm cautiously optimistic.
And I know too, with this vaccine, it's going to take 2 doses. So people, I feel like I've had such a hard time wrapping my mind around this whole vaccine, because I feel like I've been naive before with, vaccines, because they were just always readily available. Now we have this new vaccine. We're still trying to understand it. And, it's, now we're going to have to take 2 doses of this vaccine, but still also take those other precautions along the way. So it just makes me wonder how it's all going to play out, and so
yeah,
I don't know. So, yeah.
It is kind of a logistical problem and a public health problem, because, with flu campaigns, we kind of just go out in a community and we do what we call a blitz. Is we just go with the flu vaccine, we just give it to everyone. And then, we, of course, obviously we keep track of it and we chart it, but it's a little bit lower maintenance, because we can just say, okay, we got that community, we're done. With this, you have to keep track of who got it and when they got it, and then you have to do follow-up. And, when you're giving a vaccine on this scale to this many people, that's not an easy thing to do. And when you consider, I forget which one of them, but one of them has to be stored at -50 degrees Fahrenheit. So one, that requires a very expensive freezer that's not easy to transport. So when you think about small rural areas like where I am, that's a significant factor. But there's also the factor of it has to thaw for 2 days. So you have to thaw exactly the right amount for exactly when you need it. If you thaw too many, you've wasted vaccine. If you don't thaw enough, you're not effective in the community. So it's not like the flu where you can just go out and blitz and give it to everyone. There's a lot of planning that is going to go into this vaccination process. So that's another reason why I'm cautiously optimistic, but I know this vaccine is not an end all. Fauci is not hopeful that we'll be back to normal until 2022, and I'm not either.
It honestly makes sense, because the whole world is going to have to essentially get this vaccine. And, obviously that's going to take some time. And so I don't know. I know there's 3 vaccines right now that are being rolled out, being tested, and, everybody's getting closer to getting it, but, I don't know. It's just,
yeah.
It's exhausting at times, but I do have to commend you for sticking it out for sure. So since you're in the track and tracing, will you also be involved in the vaccine distribution as well?
They haven't. That's still. I've been in meetings about planning that. My role as a public health nurse, then yes, I would definitely be involved in vaccine administration. Not so much because I'm in contact tracing, but as a public health nurse, I mean that's part of my normal role right now is the vaccine campaign. So COVID, whenever the vaccine is widely available, that's our number one priority.
I've been following on social and have seen that you've been in the hospital at times. Can you kind of tell me why you were called there and kind of what you did while you were there?
The why is just a simple, they need as much help as they can get. Just like every hospital in the country right now is literally all hands on board. And I'm an RN and was ready to jump in. What we were seeing in the hospital is it's a lot and it's intense and it's just a lot of people struggling to breathe and a lot of super sick people. And everyone's stretched super thin and stressed out and doing everything they can for every patient, but resources are limited. And it's a lot of patients in respiratory distress, which is incredibly stressful. And I think people underestimate the emotional toll that takes on a person. It's caring for that many people. If you think of the concept of someone struggling to breathe and dealing with that, it takes a toll on you. I read an analysis lately that was really interesting that said 10 to 20% of COVID cases are responsible to 80 to 90% of the infections. So what that says is it's not just if I have it, it's not the way it's spreading isn't me spreading it to 2 or 3 people. It's the main reason it's spreading is super spreader events. It's people that have it and then are attending parties and giving it to 20, 25 people. And then they'll give it to 1 or 2, but then one of those will give it to 20, 25 people. So when you think about 10 to 20% being responsible for nearly all the infections, there's literally so many easy things we could be doing to stop the spread of this. Like not having parties, not going to weddings is the least that we could be doing right now. I don't think that's that drastic.
Yeah. I had a friend, she actually canceled her wedding that she was planning on doing in July and moved it till next year.
Yeah.
Hopeful, she's like one of my best friends, we're hopeful that maybe we'll be able to, do it. But she did it because a lot of the people that were planning on going, were vulnerable people. Like they were older people, and that's the people that you have to, shield this kind of stuff from. And so I don't know. It's a crazy thing, but yeah.
And that's a totally valid point, and you're completely right. But I think so you say that vulnerable people attending, but then what people don't think about is what happened. I had this year, there was a birthday party that happened and a bunch of people attended the birthday party. That birthday party caused 2 deaths of people that didn't even attend the birthday party. They weren't even there. Mm-hmm. So it's not just, if you attend a wedding, attend a birthday party, it's not just vulnerable people attending. It's also contributing to more than that. Because, those 2 people died and they didn't even go to that birthday party. So, those 2 people did everything they were supposed to do and they still lost their lives because this birthday party happened. So things like that are what makes me want to bang my head against my desk all day.
I guess, is there any kind of advice as things move forward in terms of the vaccine, what everybody should be expecting this coming year?
Well, I think everyone asks, all my friends and people that follow me on social media are ask me so, they ask me one, is COVID really that bad or is it all the media? It's really that bad. It's not the media. 2, they asked me about the vaccine, whether or not I think it's safe. I, as a human, I research it thoroughly, obsessively, even on my own free time. I 1000% think it's safe. I will be getting it as soon as it's available. I have recommended it to everyone that I love, that I want them to get it as soon as it's available. And I would recommend anyone watching this to get it. And the rest is just, what we've been told for 9 months now is please, please, please wear a mask, social distance, frequent hand washing.
Well, thanks again, Taylor, for speaking with me. I really hope you stay well and continue to, stay as positive as you can going through this. And I really appreciate you again speaking with me. But hope you stay well.
Yeah, of course. Thank you for having me.
Yeah, no problem.